I don't know everybody. I'm Dr. Lisa Allen. I'm a physical therapist. And as you know, we're here to talk about what the true reason of your back pain could be. The first thing I want to do is just go over some of the things that we're going to be talking about tonight. There's the main diagnosis, which you may or may not have. The common diagnosis like disc herniation, stenosis, sciatica, arthritis, degenerative disc disease, scoliosis, and then of course how physical therapy can help. So the first thing I want to do is talk about, I don't know if anybody saw the newspaper ad, but this is the research study that I kind of got that from. So this is one of many research studies taken from a population of people who had no back pain. So these are pain-free people. And so what they did is they took a bunch of people, hey, do you have back pain? No, come on in. Participate in our study, and they took x-rays and MRIs of their spine. And so shockingly what they found, and I just chose the 50-year-olds because they're right here in the middle, is that 80% of 50-year-old people who have no back pain show disc degeneration. 80%, which is huge. And so then you look at disc bulge. A lot of people may have your disc herniation or your bulge on your MRI. 60% of people who are 50-year-old and no back pain show a disc bulge on their MRI. So now we may want to take a couple of people. Does anybody here have had MRI or X-ray that shows any of these things? And so what did you have?
Well, I started with scoliosis.
Uh-huh.
And I've had all of those things.
So then if you kind of like look for your age group and you go, well, did they say that you had, disc degeneration? Well, in your age group, it's, 80 to 90%.
Is not up there. I'm older than
Is that right? Awesome. So, and probably then that would be 100%, I guess, by now. So I just feel like this is kind of a really powerful statement because we see people, you go to the doctor, hey doc, I've got some back pain. And they go, okay, great, let's take an x-ray, let's take an MRI, let's see what it is. Bulging disc, that's why your back hurts. And so then I found, working in physical therapy, that the thing is that the true reason for your back pain isn't necessarily what they're showing on your MRI or on your x-ray. So it turns out the major source of the pain was actually from a flexible scoliosis. And we're going to get a lot more into what that is. So after I correct the scoliosis, even with somebody who may come in with an MRI that shows the bulging disc, I find that the pain is gone or greatly diminished. And so this is amazing, of course, because some people will go and get surgery and still have the same pain after surgery. Oh, well, then what is it? And it turns out that the reason is from scoliosis. So then what happens is that regardless of your diagnosis when you come to see us, what we're going to look for is everything and treat the scoliosis in addition, because we find that a lot of people actually have a scoliosis. There's a couple different kinds of scoliosis, and I'm going to get into more of that later. Our name, of course, is BioMechanic Physical Therapy, and so what we're into is mechanics. And so we're going to look and see what all the different problems are. So let's talk about scoliosis and exactly what it is right now. So scoliosis is a rotation or a twisting of your spine, of the vertebrae. And there's two types. There's flexible scoliosis and a fixed scoliosis. So your vertebrae that make up your spine, we have here just one of these, I like to call them dominoes in the chain. And then, that's just a picture to help you look at this. And so then we can see that if we twist the spine, that you end up with a curvature that can go up. And there is what a scoliosis is. Now, I said there's two different kinds. There's a flexible scoliosis and a fixed scoliosis. The fixed scoliosis is usually what people think of when they hear the diagnosis scoliosis. That's the one, you know, with the back braces, the one that they screen for in schools. Now, a fixed scoliosis is when one of the vertebrae is not perfectly square side to side. That's a little bit of a dramatic picture. It's not really that dramatic. But when you have one vertebrae that's not exactly square, you can see that what that's going to do is cause a curve. So, we had a patient actually who brought us her old brace so people could see the types of things that, I don't know if you ever had to wear one when you were young.
No, it wasn't like that. I wore one.
And so this is kind of a really important statement that I'm making here, because any of the young people that I've seen don't get this. And if anybody works in the school system, if they're still screening for scoliosis, this is really important, that there is more to treatment than the brace or surgery. And a lot of physicians don't know this. The kids will come in with the scoliosis, with the back pain, and what we can do in physical therapy is actually keep using a manual therapy technique to align the spine and to continue to work on that while they're growing and while they're perhaps wearing their brace, so that there is so much more that can be done for these poor kids who are subjected to the brace in school and, you know, whatever comes along with that. So the goal of physical therapy for the child with the fixed scoliosis is helping the spine grow correctly. And so what that looks like is somebody would come in over and over again, and we would straighten the curve repeatedly while they're growing in order to diminish the curve over time. There's a law with bone, it's called Wolff's Law, that bone grows in response to stress. So when you're putting stresses on the bone, it's going to alter the way that it grows. So naturally what we would want to do is try to keep the spine aligned as much as possible during growth to keep any kind of abnormal bone growth growing. And of course, helping to straighten the curves, which is what the goal of the big plastic brace is to help the child grow straight. So to do this, we use a technique called muscle energy technique. And I'm going to talk a little bit more exactly about what that is later. But basically, it's a manual therapy for straightening the spine, and we do that in physical therapy along with strengthening and stretching in order to help the child grow as straight as possible. What you might say then, well, the goal of chiropractors is to straighten the spine. What's the difference between chiropractic and physical therapy when it comes to this? And really, the goal is exactly the same. The goal for both is straightening the spine. The way that we go about it is actually different. In physical therapy, like I said, some physical therapists, not all physical therapists, we use what's called muscle energy technique. And the reason why I say some physical therapists is because it's one of those things that you learn after school. It was a continuing education course. It's actually a series of courses that I took after physical therapy school. And I have to say it was jaw-droppingly impressive how much I was able to do with the spine after taking this muscle energy course. And all the therapists here in our clinic know muscle energy technique. So chiropractic, when they're correcting your spine, and some of you may have tried chiropractor before, their corrections are global, meaning it's in large segments. So if you've been to the chiropractor, you know they do the neck, the thoracic spine, and the low back. And so they correct those three things kind of in the big, just the big segments. They do not actually check for correction after they treat. Now, of course, all chiropractors are different. Maybe some of them do. I did think that it was important for me to actually experience chiropractic. So when I was in physical therapy school, I went to a chiropractor and saw what it was like myself. And I know that you kind of just go in, maybe you lay on the heat, maybe not, and then they do their crack, and then you're done. Chiropractic also uses a high velocity manipulation. Now, some physical therapists, it's true, do the high velocity manipulation, but I stand to say that the muscle energy technique is superior to the high velocity manipulation, and I'm going to talk more about exactly how physical therapy does that in a second. And then the last thing is that the chiropractors usually only work on the bone, so they work on the bony alignment of the spine. And that's kind of the beginning and the end of it. Again, the different chiropractors are different. I know some of them actually do have a physical therapist on site. But then what does physical therapy treatment look like for the spine using specifically this muscle energy technique? Number one, it's very detailed. We go vertebra by vertebrae. We look at each one, we see which direction that it's out of line, we correct it, and then we look and make sure we corrected it and make sure it's corrected. The sacroiliac joint, which is the bottom in this chain of dominoes here, so your tailbone obviously would affect the spine. The sacroiliac joint is one that I have found that most chiropractors don't seem to work on, and I think it's really important because it's actually at the base of the spine. So when this is out of line, you can see how that would put forces on the spine to have it twist. So muscle energy technique is very safe. It uses your own muscles and your own strength to correct. And it's a low velocity manipulation, meaning you're using your own muscles to correct it. It's not a high velocity manipulation. And the last thing is that when you get physical therapy, at least here for a scoliosis, it's comprehensive. Not only do we straighten the spine, we're not just worried about the bones, but we're also going to worry about the muscles, the muscle imbalances that may have occurred, and we may use things like massage, acupuncture, ultrasound, exercise, of course, to help with the muscle imbalances, stretching, and then exercises to work on the future prevention. And we're also going to go a little bit more into detail of exactly all the different things that physical therapy can do at the end after we work on the definitions for scoliosis. And so at this point, I want to take a minute to tell you a story. This is my sister. She teaches horses how to ride people and people how to ride horses. And she has a lot of high school students. So one of her students had scoliosis and her father was a chiropractor. So my sister said, the next time you're up, would you mind coming and treating my student? And so I said, sure, came up and did the muscle energy technique. And in this case, I really did just do the muscle energy technique. I didn't do any of the other physical therapy stuff. I'm just at my sister's house. And corrected her spine. She went home and her chiropractor father said, quote unquote, I am shocked and amazed at the difference that you could make in a single treatment using this technique. And so he asked if I would teach it to him. And so I said yes. So the next time I went up to New Jersey, he came over with his daughter and I showed him how to do the treatment. He was also shocked and amazed at how much time it took. It does take a lot longer than the chiropractic. So you will expect to be here in physical therapy for this treatment longer than, you know, the usual what it takes with the chiropractor. So, okay, moving on to adults who have the fixed scoliosis. So once you're all grown up, you have your that one vertebrae that is wedged, and it's always going to be that way. And so naturally we can't fix that. But what happens above and below that one fixed vertebrae is you have compensatory curves. So if you've got one that's making it crooked, what you're going to want to do instead of walking around with your head on crooked is twist your spine back, and you do this without thinking about it, to get your head on straight. And those are compensatory curves. Now, over time, people, generally adults who have the fixed scoliosis, will get pain above and below where their original point was. And so then the goal of treatment for the adult who has the fixed scoliosis is to unwind the scoliosis, the flexible scoliosis above and below, or either or, the area that's fixed that we won't actually be able to change. Okay, so I've also found that there's a particular pattern that happens when I'm working with adults who have the fixed scoliosis. Usually the first time that they see me, well, first of all, they're surprised that something like this can be done. And then it takes months of the muscle energy technique done 2 or 3 times a week, straightening the spine over and over again until they get to the maximum benefit. You know, they're feeling good, and there's not as much work to do each time in physical therapy. Then they usually return about a year later because their pain's starting to come back. And so then you have another round of physical therapy, but this round of physical therapy doesn't take quite as much time. And then they end up getting pain relief for longer and longer periods between the sessions. So I may see this person repeatedly over the years, but over the years there's more and more time between the times that I see them, and the amount of time that takes for me to get them happy again is shorter. So now on to the more common kind of flexible scoliosis, and the kind that I was really talking about when I say you go into the doctor and you show a herniated disc or a bulging disc on your MRI, and surgery maybe didn't fix your pain. And this is the flexible scoliosis that a lot of people don't really realize they have. In the flexible scoliosis, your vertebrae are normally shaped, so you're not having any curve that's enforced on you. It is completely correctable because you're not having a wedge vertebrae that's keeping us from being able to move forward. And it's often the overlooked source of pain because there's not actually a lot of therapists who know this muscle energy technique. I know because we have patients who move far away, or friends and family, or patients' families, and they say, oh, I want to get that, do you know anybody in my area? Usually I just have them call the people who the instructors of the course that I took, and see if they'll release the names of other people who have attended the course. Okay, so obviously the joints of the spine are made to move and flex as you move and flex, and you can see this here. The joints here between the vertebrae, I don't know if anybody can see that, but it's almost like a little where your fingers would meet. It's a small overlap of the bones there, and that's where you get the sliding between the bones when you're moving around. Now the ribs also come and join here, and they touch these, and you also get a small sliding joint there. And then lastly, at the bottom of the spine, you have your tailbone where it meets your hip bones. These are your big hip bones. And this is also a shallow joint that's made for sliding. So what happens is when you slide this too far, these joints move past one another and get stuck. And they're called facet joints. Maybe people have heard that they have a facet problem. So these facet joints then will get stuck. Same thing with the sacroiliac joint here. You move too far and it ends up getting stuck. And that's what gives you your flexible scoliosis. It's moved too far, it's stuck, and it's caused a twist that you can't untwist. And so, oh, there's the SI joint again. Again, it's important part of the dominoes. And so you say, well, how does this happen? Well, the flexible scoliosis can happen in a lot of ways. And actually, the ribs, the spine, and the SI joint all work the same way and can move too far and get stuck. So for instance, when you stay in one position for too long, like sleeping, and probably most of us have woken up at one point in time with a stiff neck and you can't move your head, that's a flexible scoliosis. Your facet joints have gotten stuck because you stayed in one position for too long and things slid past each other too far. And then we can unstick that with the muscle energy technique. Driving, going on a long drive, working, staying in one position. Maybe you sit funny at your desk with the computer. Studying, lifting something too heavy. That's kind of a classic one. When somebody lifts the piano and then they have the pain right here, or helping somebody move. That's your sacroiliac joint that's slid out of line. Pushing something heavy across the floor with your foot. That's a way that you can slide it out of line. Slipping and fall, obviously, like on ice, or off of a ladder. Or kids or adults, tackled in football, those kind of sports. All those things can actually cause you to have your vertebrae move far enough that then they get stuck and you're not able to put them back in line by yourself. Now, sometimes you wait for the pain to go away, and sometimes your neck does unlock. But sometimes, for instance, when somebody is helping somebody move, they end up with that pain here or wherever it may be, and they wait for it to go away. Now, sometimes it's true because the spine is made to move around. It will unstick and then move properly. But I've set up a little demonstration for you here to show you kind of what else happens. Okay, so this is a muscle. And muscles obviously in your body are attached to various and sundry things at either end. And so this is a vertebrae. So if I take this vertebrae and I twist it, you can see that what I've done is I put one side on slack. I'm about to lose my weight there. I put one side on slack and the other side is tight. So this is a muscle, for instance. So then over time, while you're waiting for this to get better on its own because you don't want to go to the doctor or whatever, this muscle will get longer, this one will get shorter, it'll adapt, and the main part of your pain will go away. And you say, well, you're good. Well, you're not actually, because that bone is still slipped out of line. And that's how you end up with this situation where once upon a time, you hurt your back helping somebody move or something like that. The pain went away, but still, your back's never been the same. You still can't help somebody move. And the reason why you can't is because most likely, when I'm using the example of moving, your SI joint is still out of line all that time, and your muscles and your ligaments have just accommodated. So then what we can do to get you back to where you were before is, of course, put that back in line using the muscle energy technique. We have a little bit of a bigger job to do, of course, because now your muscles and your ligaments have adapted to that position, and we want to fix that. Car accident is another big one. Where you get in the car accident and you're sore, and and it kind of goes away, but then your neck's really never quite the same, and it's often the same reason that you actually now have a flexible scoliosis. And speaking of chiropractors, if anybody has been to a chiropractor, one of the first things they do is they x-ray, and they'll point out to you what has happened with your curves or lack thereof, and so they will actually note this flexible scoliosis to you. So they are very aware of that. So muscle energy technique is a method where we actually position you in such a way. There's different positions of different joints that allows them the most slack. And so we're going to position you in this position where you have the most slack in that joint. Then we're going to have you resist in a certain way depending on which way you're out of line. And your own muscles will then pull the vertebrae back in line. Now, if you have this situation where you've got your muscles and your ligaments accommodated, they're going to pull it back out again. So we've got a little bit of arm wrestling to do in the case of somebody who's had this going on for a long time. But I actually have another cool story. There was at one point in time I was practicing across the hall from a physician's office, and this guy came in. He'd been doing something, threw his back out, came to the doctor. The doctor just sent him across the hall to me, like immediately. So he got into the doctor right away, walked across the hall, said, hey, can you work on me? And I fixed his back. And it was actually cool because I still call him my one fix wonder, is that because he had just done it and he didn't wait for it to go away, I was able to put it back. And then, of course, we do the kind of the core strengthening and stuff like that to stabilize it. But if it's kind of a stitch in time saves 9 situation, where if you get it fixed right away, then you have less work to do in the long run. So I don't know if we have anybody here today who kind of has a pain right about here. Yeah? You want to come on up and be our guinea pig?
Oh my goodness. I should not have raised my hand.
We can pick somebody else if you don't want to be the guinea pig.
Sexiness now.
Okay, so let's see if you've got what I'm looking for. So good, your feet are in a nice... No, you're fine, you're fine. It's light color, so I think it'll be good. So I'm putting my fingers here at your SI joint. Now go ahead and bend forward. I don't know if anybody can see how my left thumb is higher than my right. Can you see that? Go ahead and stand back up.
Yeah.
Okay, everybody got it? Okay, so now we're going to fix it. You don't have any fusions, right?
What is fusion?
Nobody did surgery to fuse your...
No.
Come on over, we're going to fix it. So go ahead and lay on your back here.
Oh.
Put your head this way and on your back. And come over to this right edge of the table. Yep. And I'm going to raise the table up. And go ahead and lay flat. Do you want a pillow?
I'm fine.
You okay? All right. So the first thing I'm going to do is pick this leg up. Let me have it and relax it. And I'm going to put my hand behind your back. I'm going to put my hand on that joint again. And then I'm going to raise your knee. Now what I want you to do is to push this knee up to the ceiling. Push up, 2, 3, 4, 5, 6, relax. Good, and relax again. Let me have your leg. Very nice. And now push up again. Push up, 2, 3, 4, 5, 6. So I'm having her use her own muscles to help pull this all back in line. Go ahead and push up again. 2, 3, 4, 5, 6. Good. And push up again. Good. relax again. All right, now go ahead and scoot to the other side of the table. So this time, I'm going to take this leg and put it on my shoulder. So just rest it there, if you will. Just give me the weight of your leg. I'm going to feel that joint again, and I'm going to move your leg around. Okay. Now I want you to push down with your thigh on my shoulder. Push 2, 3, 4, 5, 6, and relax. Beautiful. You're doing great. Go ahead and push down again. 2, 3, 4, 5, 6, and relax. Good. And down again. Good. And one more time. Let's go all the way down flat. Okay, and now push down with just this left leg into my hand. Good. And relax. Okay, I'm going to lower the table so you don't have to jump. Oh, your glasses.
Thank you.
There you go. Go ahead and stand up with your back to the audience again, and we're going to see if we fixed it. So good. Let's come on back over here and spin around facing the wall again. Yeah. And now let's see. Make sure your shirt doesn't pull me off. Okay, good. Now go ahead and bend forward again. Ta-da! And stand back up. So you can see my thumbs didn't move separate that time. So this one was stuck. So when she bent forward, the whole thing moved as a piece. And now it slides freely. So if you have more stuff going on, you may feel a little pressure between your tailbone and your low back. If you do, let me know and we can work on that. But since we only fixed one piece, then you might feel pressure from the parts that's fixed to the part that's not fixed. Thank you very much.
Thank you.
All right.
Treatment today.
Okay. And so now how about those other diagnoses and how do they relate to scoliosis? Because they can actually be interrelated. So the first thing I want to talk about, sciatica, muscle spasm, and scoliosis. So first of all, sciatica is that most people know that pain that runs down the back of your leg. The sciatic nerve is a huge nerve, about big around as your thumb, that runs out of your tailbone and down the back of your leg. And then there's muscles that run across. Oops, did I skip one? Yeah. Then there's muscles that run across that nerve. So my point here, and what we're about to go into, is that there's more than one way to pinch a nerve. You can pinch it with muscle spasm, you can pinch it with a bulging disc, or you can pinch it by bone, stenosis or scoliosis, the two different things that would pinch a nerve. So let's take our first example. The sacroiliac joint, that joint right there at the bottom, the one we just fixed for her. When the alignment of the sacroiliac joint is out, of course you can't just have pain in the joint itself because naturally the two pieces are not lined up like they're supposed to. So you can have pain just from that. People usually just talk about focal pain right here, sometimes stabbing, ice pick. They'll use words like that. But the pain also could be from muscle spasm. And that muscle spasm can be related to the malalignment. So you pick something up that's too heavy, you twist it, you throw the sacrum out of line, and then because you have this one muscle is short and one muscle is long, now you have muscle spasm. So that muscle can actually push on that big fat sciatic nerve and cause sciatica from the muscle spasm. Well, a lot of times you go to the doctor and they say, well, you have piriformis syndrome. And so you go to physical therapy and, we'll massage the piriformis and work on that, stretch it, give you some stuff to do at home. And so all we're doing really is handling one piece. All we did was work on the piriformis muscle. Well, why is the piriformis muscle in spasm? Well, maybe it's in spasm because the tailbone's out of line. So then we need to fix the tailbone to handle the piriformis problem. Maybe you did something else to it, but sat on a nail, something like that. But maybe it's because that tailbone's out of line. Okay, and now the bulging disc. This one gets a little bit more complicated. There's a normal spine and there's a spine with a bulging disc. Here's a couple of MRIs showing you. This is the normal spine. These are the discs. And you can see here's a disc that's pushing on the spinal cord. And then here's a neck, same thing. The discs and the disc pushing on the spinal cord. So if we look at this diagram here, This is the one we're talking about with the herniated disc. So here's the normal one, and you have, this is the spinal cord running down the center, and then these are the nerves as they exit the sides. So you've got the big spinal cord running down the center, and then you have the little nerves that come out these holes on the sides. So if you have a bulging disc, then it can push on that little nerve coming out the side. And so it will cause a stenosis. But look what happens to this little hole on the side here when I twist the spine. I can change the shape of the hole that the nerve runs out. So there's the nerve sitting happily there, and I twist this here, and what did I do? I just pinched the nerve. So if you've got a bulging disc and a scoliosis, I can take the scoliosis away, I can fix that, and then you just have the bulging disc left. So maybe that's why you might show a bulging disc on the x-ray, on an MRI of somebody who doesn't actually have pain because that person maybe also didn't have a scoliosis. So if we look at these other diagnoses too, this one is some arthritis, where there's some, when you have arthritis, you kind of get the bony overgrowth from the irritated bone there, and that would make this hole smaller. So if I have the bony overgrowth and a twist, then it's made that hole double small. So you may have stenosis, and it may be a bony thing, and you may go, well, a doc's like, well, there's nothing you can do for that, but use roto-rooter and make the space bigger. Well, I can. If you happen to also have a scoliosis, I can untwist that and then make the hole bigger, that nerve comes out, and then take away your symptoms using that. This is the stenosis that a lot of people think about. This is the bony overgrowth of the actual body of the vertebrae into the central hole where the spinal cord runs. And that one I'm afraid I can't do much for. But there's a lot of them that we can. So opening up the space where the nerve exits the spine is one of the biggest ways that unwinding a scoliosis can eliminate sciatica and other nerve pain. Now, the realignment of those little facet joints can also help take away your back pain, because you can have back pain from the little facet joints not sitting on themselves like they should, from the muscle spasm or the pull on the ligaments that's abnormal from it being out of line, or from the pressure on the nerve. So you've got multiple different things that can be causing your back pain. And a lot of things to do in physical therapy that we can fix it. So regardless of your diagnosis when you come to us, we always handle the mechanics of your whole body, hence our name, and the type of therapists that we have here. And I do apologize for, I don't know if anybody's in therapy now, where we don't have quite enough therapists to cover the number of patients that we have. But hiring only the best PTs means that we have to hold out for just the best. So if we've been inconveniencing anybody by making you come at times that aren't your ideal, sorry for that. So what can you expect from physical therapy? So we've talked about unwinding the scoliosis with a muscle energy technique, but then there's also a lot of other things that go along with it. So there's things to handle your pain, massage, heat, electrical stimulation, iontophoresis. Iontophoresis is actually a very cool technique where we deliver a steroid with electricity. So if anybody's ever had the steroid injections to whatever painful joint you have, in physical therapy we have a way to deliver it where you don't have the risks and side effects of either taking the pill or having the injection. And so it's a very powerful way to take inflammation down regardless of where it is. We also have quite a few things to actually speed the healing. Laser, the red laser can actually cut your healing time in half. So if you were to break a bone or have a soft tissue damage or arthritis, it will heal that area in half the time. You wonder how these sports guys get back on the field so soon? They've got a couple of things. They've got ultrasound and they've got laser. So then also in physical therapy, we'll do things, of course, to correct your alignment and other mechanical problems. We've talked about the muscle energy technique. There are other mechanical things that we can do actually for bulging discs and for loss of disc height, such as traction. There's some other manual therapies that we can do. And then, of course, we're going to be correcting your strength, your range of motion, and any of those imbalances that you might have, especially if the problem has been going on for a long time. We're also going to do things to keep the problem from coming back. So we're going to do exercises. You may have heard of core stabilization, buzzword in the gyms for the past several years. And then we'll also look at how you use your body, like I talked about earlier. Maybe there's a funny way you're sitting at the computer. Maybe you always pick up the groceries or the child with the right hand, and that's causing something to get repeatedly pulled out of line. So we'll look at how you use your body, and then we'll also do the core stabilization and the strengthening to help correct the imbalances and help you better handle the slings and arrows of life, as I like to call it. I'll give you another story. I've had a couple of patients in my time who were big, muscly guys. Got in a car accident. One was a car accident, one was a motorcycle accident, thrown 40 or 50 feet and didn't break any bones. Why? Strength, brute strength. So it really does behoove you to be strong. If you're strong and you try to do something that is too much for your back, for instance, maybe you won't pull that vertebrae out so far that it'll get stuck. But it also helps with the longevity of all your joints by being strong. So I'm a big advocate of plain old brute strength. And so then the other thing that I like to point out, especially if some of you have had physical therapy for your back pain and you went in and you got exercises, and now when your back starts to hurt, it's because you stopped doing your exercises. Well, I don't believe in doing only exercises for back pain. I think that it's an important adjunct, but the people who have gone to physical therapy and gotten those exercises, and that's all they did, and they do those for their whole life, what they're doing is they're stabilizing that joint that's out of, or joints, it's because in the spine it's usually a bunch of them. They're stabilizing that joint that's out of line, and that's what helps keep them from having pain. As long as they do their exercises, they don't have pain. I, of course, believe in fixing the mechanical problem underneath of that and then strengthening on top of that, because the exercises alone are actually completely against my philosophy. So these are some pictures of some of the things that we talked about. This is the iontophoresis. They're delivering the steroid with electricity. That is actually one where there's a microcircuitry patch. It has a teeny little battery and some little wires in there, and it delivers the medicine slowly. This is actually the same thing, but the one we use in the clinic. This one here is the cold laser. Here is Gary doing a manual therapy technique. These folks up here are doing some core strengthening. This here is the electrical acupuncture. Oh, we forgot to turn out the lights. Gosh, you guys, hopefully you've been able to see the slides okay. Is that better? There's another light over there we didn't turn off. Sorry about that. This is automatic ultrasound. It's actually more effective. Probably a lot of people have had the ultrasound where you have the wand and the blue gel and they rub it on you. This is an automated version, and it's supposed to be more effective because it takes the human element out. And this here is cupping. That was very popular, made very popular in the Olympics. We actually do that here. It's not a picture of everything that we do, but it gives you an idea. And so one of the important things that I want to say too is no matter how long it's been, how old you are, or what your diagnosis is, we can help. I've seen patients who have had back pain for 30 years, and I've been able to help. I've seen people who maybe they're older and they go to the doctor and they go, of course your back hurts, you're old, what do you expect? Well, I happen to disagree with that. I think that there is something that we can do. You don't just have to put up with it.
I am hopeless.
No, I can assure you you're not. We already did something. And then also it doesn't matter what your diagnosis is. Maybe you have a diagnosis of stenosis, but maybe we can still help you by unwinding that scoliosis or whatever the case may be. And there are, of course, treatments specifically for arthritis and a bulging disc that we would also do in addition, of course, to the muscle energy technique with the unwinding. And so then last but not least, I don't know if I've answered everybody's questions. You can feel free to take some, but Also, if not, or if you would prefer to have your questions handled one-on-one, we do offer free 15-minute screenings. So we can have a look and see what we can see and let you know whether we think we can help you or not. And that's it, unless anybody has any questions.
Yeah. About that, is that
Iontophoresis.
Because my doctor, before I came here, I went to my spine doctor, and then he mentioned to me if the pain is with the pain I'm having, he suggested to me that I go to that. It's like they inject
prolotherapy.
Yeah, but then I have to have MRI first so that they will know exactly where they inject on my spine. Is that the same thing?
Well, there's a lot of different things they can inject in your spine. Yes, they often will inject a steroid into spine.
They have to numb me, and I have to have
the guided, yeah,
right.
Yeah. That they're probably trying to inject something perhaps in your spinal canal. But also they would do that when they're working on these small bits that come out the side. But if you have some sort of inflammation, arthritis, or some sort of pain like that, the steroid treatment will help inflammation of arthritis, and that's no matter what arthritis, you know, toes, knees, shoulders, elbows. It's great with that. The drug actually goes 3 centimeters deep. So anything that's arthritic. So if you have some arthritis that he's wanting to do the injection for, yes, that would help with that. If you have inflammation from a car accident or some other type of injury, tendinitis, the facet joints actually also get inflamed, the little teeny joints, and that would also be helped with the steroid treatment. It doesn't have any risk or side effect except perhaps irritating your skin. And the little patches cost an extra $10. So it's a pretty low risk thing to do. So you could certainly try it, you know.
I heard it hurts, but
no, it feels tingly. It feels tingly like pins and needles. I don't know if anybody's had the iontophoresis here. Yeah, it doesn't hurt. No.
That's why when I heard about this biomechanic, I said maybe I'll just try this first instead of getting.
Oh, the big thing. Yes, that hurts. Yes, with a fluoroscopy. I thought you meant the iontophoresis. Yeah. No, the iontophoresis does not hurt. No, the iontophoresis does not hurt, and that is, you know, so, you know, we could certainly try it, and you would know. You know within on the same day of treatment, and the pain relief lasts for a couple of days before it comes back. But then when the pain comes back, it shouldn't be back as much as it was before. So the downside of the way we deliver it is that you have to repeatedly do it. So you would be coming in 2 to 3 times a week, and we deliver the steroid. Your pain's great, and then it starts to come back a little bit, hit it again. And so steadily we get the pain down more and more. But you would know whether it was going to work for your pain. But we could, of course, look and see what is going on and what is the reason that they want to do that. You know, I don't know if they're wanting to put a steroid in your spine to decrease the inflammation inside the spinal canal, or but there's a lot of things they do. They'll do injections to cause scar tissue to form to stabilize something. They'll do injections to decrease muscle spasm. There's quite a few things that they'll do the injections for.
Is that the same steroid that my spine doctor
is
yeah. giving?
Yeah, dexamethasone sodium phosphate. Yeah, it's the same steroid. It's just we deliver it a different way. Yeah.
I've already had 40 visits here this year on the Medicaid.
Woo!
I'm seeing Ashley now. I've seen her for 3 months. Is any of this what you're saying tonight going to help me? I have scoliosis. Is it ever too late?
No, it's not too late. Have we treated you for your spine?
Well, that's what the 40 visits for.
Was for your spine?
No,
they may have.
Spine per se, but all over.
We'll have to pull your chart, and I'll look and see what they did.
Well, can I have the 15-minute screening?
You sure can.
Thank you.
Yeah, and we'll pull your chart too.
All right.
Yeah, yeah, for sure.
So, what's the primary reason the spine starts to curve in young children and continues through the growth cycle?
It's actually.
Because this information is different from what I've always thought.
Yeah.
I mean, you're talking about, you know,
Yeah.
scoliosis happening possibly as a result of slipping,
Right.
slipping.
That's
And
the
so-
flexible scoliosis.
Okay, but for the fixed, I mean, that starts.
Right, that starts in childhood while you're growing, and it's just an abnormal growth of that vertebrae.
That wedged vertebrae.
Right. And so then, at least when I was in school, we were doing the bend forward screening where they were looking for the rotation of the ribs and such. By the time, you could see that perhaps in school, it's advanced to a certain degree. But no, it's just an abnormal growth of the bone.
Okay.
And so then what they're trying to do with the brace is to keep that from continuing over and getting you to grow straight. And actually, one of our patients actually brought this in for us. So she had actually had quite a large torsion this way, twisting through her body like that. But the reason why I think it's so important that kids get the muscle energy technique along with it is because I just feel like there's so much more that we can do rather than to just kind of let things take its course and force it back with the brace. I do think the brace is important to do with the physical therapy if that's going to help with that one wedged vertebrae. But I really feel like it's a powerful treatment that a lot of doctors don't know about. And for a long time I've thought, how am I going to tell people? How can I get this out there? And I also thought it was, perhaps such a small segment of the population. Maybe I could talk at schools or something and tell people, that there's something else that can be done for the fixed scoliosis. Yeah. So, anybody else? Great. Well, thank you for coming.